I know of someone who has had a bad cough that lasted for 3 weeks, pain in the chest, cough with mucus, felt weak and tired, had unexplained weight loss, chills, and fever. Is this tuberculosis? Is it a death sentence? Well, about 1.8 billion people, or 1/4 of the world's population, are infected with tuberculosis. Statistics from the World Health Organization shows that every year around 245,000 Nigerians die from tuberculosis and about 590,000 new cases occur. An estimated 74 million lives were saved through TB diagnosis and treatment between 2000 and 2021. The Institute of Human Virology in Nigeria added that TB patients infect 15 people annually and 300,000 cases are left undiagnosed nationwide every year. Tuberculosis or TB can be cured with treatment. Without it could be fatal. Spectrum Television was out to solve the problem of tuberculosis by explaining what it means, the signs, symptoms, complications, preventive measures, and treatment.
Do you have cough? What kind of cough do you have? Well, are you sure the cough you have is not tuberculosis? Have you checked it? Listen, in 2021, 10.6 million people worldwide suffered from tuberculosis. 6 million were men, 3.4 million women, and 1.2 million children. Tuberculosis affects people of all ages. It doesn't matter how old or how young. Well, I'm out here to find out what is tuberculosis? What are the causes of tuberculosis? What are the signs, the symptoms, and the possible treatment?
What is tuberculosis?
If a layman asks me what is tuberculosis, I will simply tell him it's what he knows, that it is cough. But it's not a common cough. Tuberculosis is what we call a deep, long cough. It affects the lungs.
What is the biggest cause of TB?
Tuberculosis is an infection caused by a tuberculosis, Microbacterium tuberculosis. So these are the microorganisms that cause tuberculosis.
What are the types or categories of TB?
We look at, like I said, the tuberculosis bacteria, which is Mycobacterium tuberculosis, is a long disease-causing bacterium. That is majorly where it occurs. And how does it happen? You know that the germ, when it enters the system, lodges first in the lungs. And from there, it enters the bloodstream. From the bloodstream, it can then progress to other organs, like we have mentioned, the kidneys, the spinal cord, the brain areas. It can go in there. But first and foremost, it must be in the lungs. It's only when it is in the lungs that it can be transmitted easily. It is only the ones that is in the lungs that can be transmitted easily. That means that if you have extrapulmonary tuberculosis, that is tuberculosis outside the lungs, the one in the lungs is what we call the pulmonary tuberculosis. Then outside the lungs is called the extrapulmonary tuberculosis. If you have the extrapulmonary tuberculosis in the spinal cord, in the brain, in the kidneys, they may not be transmitted from there.
How is tuberculosis spread?
The roots of infection is almost one channel, which is, first of all, it must enter through the nasal region and then gets into the lungs. So the ones from the other parts, the extrapulmonary tuberculosis, may not, emphasis may not be transmitted to humans. The ones that can be communicated, it is a communicable disease. Maybe I did not mention that. It is a communicable disease that that you get through inhalation. It is the droplets from the infected person that can pass on to the uninfected person. What we call the droplets are the small drops that comes when you cough or sneeze or blow your nose. What floats in the air at that time these ones form the droplets that another person that passes at that point, after the person had done its business and gone away, another person that comes, that inhales, it enters that's why it is said to be communicable disease.
What are the signs and symptoms of tuberculosis?
Some signs and symptoms of TB that some people may also neglect are coughing, persistent fever or intermittent fever that we may have this week, next week goes, come back. Then drenching night sweat. This one, if no matter how the weather is cold, that person is still sweating. That is the symptoms of TB. That is the signs of TB. So that is none. Coughing. Now another one is losing of weight. This person that was fat before is losing weight every day. He's going to the hospital doing HIV test negative. Have you gone for TB screening? So these are another thing. And how do you know that person? Some of the time people in the community will tell them to use their clothes. The clothes that you wore last 2 weeks, check this week. What is the size? What is the difference with your waist? You have to check that.
So the major sign is that you will cough, but the cough is typical. The cough of tuberculosis is typical. It is deep cough. It has a deep sound, like you know that something is coming from inside. It has that kind of deep cough, and it's always productive. It will produce large amount of sputum. Sputum is that thing you bring out when you cough. It produces sputum generously, and then you discover that the next moment the person will start losing weight. He loses weight drastically. He loses appetites. He sweats in the nights, and you find that he has what is called nausea, feeling like vomiting. These are the symptoms you will find, and of course, like we always say when we are educating the public on symptoms of an infection, there is always this warning that you don't, every time you see an individual with those kind of symptoms that were listed, you conclude that this person is a tuberculosis, because many of the diseases that we have, ordinary malaria, there's a person that has ordinary malaria and the next moment he has cough. So if you are not careful, you discover that you start calling a man that is presenting symptoms of malaria as being a tuberculosis person.
The risk factors associated with tuberculosis are many. What are they?
What will expose somebody to tuberculosis is overcrowding. If you stay in an environment that there are too many people for the given space, you have to be worried, because if one person has tuberculosis among you, then it will spread like wildfire. So that is overcrowding. But even when there is no crowding and you have a consistent contact with somebody who is tuberculosis positive, that is somebody who has the disease, maybe we will need to differentiate between tuberculosis infection and tuberculosis disease. Somebody who has the disease and you are consistently exposed to that person, then even when there is no crowd, you may get it. It's most likely a consistent contact with an infected person will infect you with tuberculosis. Your own condition again, as your health position, also matters. For instance, a person who has who is immunocompromised, somebody whose immune system, the ability of the body to fight disease is no more as good as a healthy person. That is also a risk factor. For example, an HIV patient will most likely, if exposed to tuberculosis, to an infected person, will easily get infected. So that is one of the risk factors. The other risk factor is somebody who is a substance abused person, somebody using hard drugs, injectable or finished sort, is also at risk of having tuberculosis. An alcoholic equally, yeah, somebody who takes alcohol is also at risk of having tuberculosis. And of course, we used to equally mention that that some illnesses predisposes you to having tuberculosis. Diabetes, for example. A diabetic patient will commonly have tuberculosis. Babies also. If you follow the line, you discover that the defense, the immune system of the baby is just growing. So he's equally at risk, and the aged.
A popular aphorism says, prevention is better than cure. What are the preventive measures against TB?
People have to just know the difference between ordinary cough and the cough that is related to tuberculosis. And another one, everybody have to be careful. I think it's being advisable. All the parents should ensure that they pass through ANC so that immediately after they put to bed, they give their child BCG injection.
Are there specific tests for tuberculosis?
Tests can be done in quite some ways. After the clinical diagnosis, you can go to the laboratory, which is like the gold standard. The tuberculosis bacteria must be seen in the sputum of the patient. That is a cough. That is the gold standard. You go to the lab and you do what they call a sputum smear and use a certain method to do the staining and look out for the bacteria. It is said to be an acid-fast bacilli because it is resistant to acid. So that is what differentiates it from other bacteria. So it will be exposed to acidic condition, and if tuberculosis bacilli is there, it will resist. Other ones will be destroyed or change form, while this one remains intact, and you can see them as red bacilli. That is the gold standard in diagnosis. But you can also, imaging scientists also do diagnosis. The X-ray, the radiologist, they also do X-ray of the chest region and look out for some appearances that suggest that there is tuberculosis. So imaging scientists also have a part to play for what we call tuberculosis infection, which is the latent form of tuberculosis. Somebody is carrying the bacterium, but he is not coughing, he's not having any symptoms. There is no risk there because that person cannot transmit the germ to the next person. But there is a test that is always done to check out, does this person have the bacilli in him, and it can be done even when one does not have the symptoms. If you are doing a survey, if one comes into the hospital and you do all the clinicals, it suggests you go to the lab, the smear does not show the bacterium. Let's do a tuberculin test. It is a skin test that the tuberculin is injected into the skin, and you look for the induration. Induration is swelling. It is at the lower arm of the patient. You give it there and leave for some hours, and then you observe for the induration. How much is the swelling? That can give you a clue, though this is not very much accepted in HIV and tuberculosis treatment in Nigeria, because a lot of us take the tuberculosis vaccine. Some of us who do not even take the vaccine have been exposed. So if you do a tuberculin test on a good number of a good proportion of the population, you may have significant induration. So it may not help you much. They will have a lot of false positive there, but it gives you an insight. What can also guide is a blood test. Blood tests give a lower level of false positive. But however, like I said, the gold standard in diagnosis of tuberculosis is the sputum smear microscopy. That will give us exactly what we need.
Who can get tuberculosis? Anyone can have tuberculosis. However, not everyone who is infected with the TB germ, latent TB, develops clinically active tuberculosis disease. People at the highest risks of developing active TB disease are those with weak immune systems, including babies and young children, people with chronic conditions such as diabetes or kidney diseases, people with HIV and AIDS, organ transplant recipients, cancer patients undergoing chemotherapy, people receiving certain treatments for autoimmune disorders such as rheumatoid arthritis or Crohn's diseases, and those exposed to TB patients. Can tuberculosis be cured? Yes, most cases are cured with antibiotics, but it takes a long time. You have to take medications for at least 6 to 9 months. Is there a vaccine for tuberculosis? Yes. In certain countries, the Bacille-Calmette-Guerin BCG vaccine is given to babies or small children to prevent tuberculosis. The vaccine prevents TB outside the lungs but not in the lungs and is not a guarantee. Research is still ongoing to find a vaccine that can cure tuberculosis.
Vaccination in tuberculosis, that's good. But it has limited use. One, because when you give your clients, your patient, the vaccine called BCG, it kind of raises antibodies against the bacterium. And at any time, even when the person is diseased with the organism, like I said, we differentiate between tuberculosis disease and tuberculosis infection. You can be infected and you don't have the disease. You can be infected and you live all the days of your life without having the disease. You are a normal person. You don't cough. You are not sick. You are a normal person. We call that latent tuberculosis. It is the disease tuberculosis that is of concern. So to give somebody BCG as a vaccine gives us the challenge of you want to diagnose, and then you give the tuberculin and it gives positive, whereas the person is not infected. So diagnosis becomes difficult at that time.
What is the treatment for tuberculosis?
Yeah, tuberculosis is treatable. In fact, it is curable. The important thing in tuberculosis treatment is adherence by the client, by the patient. Taking the instructions, abiding by the rules, and then taking your drugs as you are asked to take. Taking instructions include, like, even when we say you are positive to the diagnosis and you are treated and you are still taking alcohol, it may not work. That's adherence to the rules. But the other side is that you must also not violate the timing for your medication. That's why we have what we call the directly observed therapy, DOTS. DOTS is designed just because we have observed over the years that Nigerians and a lot of us, particularly men, we feel it is bravery that you are sick and you take drug for 1 day, 2 days, and the symptoms seem to relieve, and you start going and you abandon the drugs. So this brings about a lot of resistance. And what we do to forestall that, to abet that, is the DOTS. You have been diagnosed to have tuberculosis. You now have a session. After you are counseled before the test, and you are counseled after the test. And during the counseling, after the test, if you are positive, you now come into an agreement with the healthcare provider. Where can we give you your medication that is comfortable to you? Could be your place of work, could be your home, could be your village council, could be your church, anywhere that you feel comfortable, and we know that you always be seen there once we come. If there are more people, a few people around you that need the drug, they are collected to the same location, and the officer will come at a given time, give you the drug. You come with your water, give you the drug, and watch you take it, and then we are sure for that day, and then the next moment the same thing repeats. So that is a design by the program to make sure that people do not abuse the drug to result in resistance.
Tuberculosis is not like HIV. There's a treatment. It's not lifelong. It can be cured. Yeah, it can be cured. So immediately somebody is being, because one is to diagnose that person of TB, tuberculosis. If the person is being diagnosed, to heal, we have different routes, either through X-ray or through gene expert. When the person is being diagnosed, we have different treatment measures. We have a treatment call for this thing, and in the hospital there's what we call DOTS, direct observation therapy, because some people default these drugs, and the worst is that people that default or do not adhere to the treatment cause of tuberculosis, they are likely to come down with resistant virus, and when they come down resistant virus, are very dangerous for health. Most of them will be very difficult. Let me just say the way it is. Most of them will be very difficult for them to survive. Because one, if you form resistant to the first treatment, those drugs that they gave to you, how are you sure you will not form resistant to the second one? And you form resistant to the second one, what are you going to do? That is the problem. So that is why we now advise anybody under the course of treatment, even here, we monitor those persons. We make sure that before we give you the second drugs, we see the first one. And if you are admitted in the hospital, you take that drugs in the presence of an health worker to confirm you have taken the drugs, to avoid resistant virus, coming down resistant virus. Because if this person transmits resistant virus to another person, this virus that already formed resistant, means transmitted, I think it's always very dangerous.
What are the complications associated with uncontrolled tuberculosis? Tuberculosis infections can cause complications such as joint damage, lung damage, infections or damage of your bones, spinal cord, brain or lymph nodes, liver or kidney problems, inflammation of the tissues around your heart.
It affects the lungs. So you have tuberculosis that will produce cough right from inside, and then that is the one that is most common because it affects the lungs, and produces cough. But you have we have the bacterium affecting other parts of the body. You can have it affecting other parts where we call the systemic infections. It can affect the kidneys. It can affect the spinal cord. It can affect the bone. It can affect the bones of the system, and then it can affect the brain. So you have it affecting those other areas besides the lungs that produces cough.
What is the relationship between tuberculosis and HIV? People with HIV and AIDS and other people with weakened immune systems have a higher risk of catching tuberculosis than people with typical immune system. Let's hear from professionals.
This virus, this microorganism can be contacted by everybody, irrespective of your age or your sex. So what we do here is that, especially we know that HIV and tuberculosis they are husband and wife. So that is why we put our eye to, especially for people with HIV, because of their immune system.
Tuberculosis occurs in every part of the world. All age groups are at risk. However, tuberculosis is preventable and curable. Early detection and treatment can guarantee a healthy life. Get that cough checked today.
The only language one is expected to speak is a healthy language. If you're healthy, you must be sound physically, mentally, emotionally, and otherwise. Are you truly healthy? Get that cough checked today. Let us stop the spread of tuberculosis. I am Blessed Dickson, reporting for Spectrum Television News. Enjoy the rest of our programs.